Hello children, welcome to the digital class. Today we are going to learn an interesting lesson from 8th standard called Public Health and Government. Before going to the lesson, I would like to ask you a question. Can you name few things which we have to lead a healthy life? Yes, to lead a healthy life we need so many things. Like we need good health, yes, good schooling, education, transportation and good immunity levels and nutritious food, safe drinking water. All these things are required for us to lead a healthy life. Did you understand my point? Right. So, we need so many things to lead a healthy life. All these things what I have discussed to you like food, safe drinking water, education, transportation, etc. all these are called as basic amenities. See children, I would like to show you what are all the basic amenities. See, I have discussed it to you earlier that food, clean drinking water, sanitation, education, all these are called as basic amenities without which you cannot lead a healthy life. So, let us go into our lesson called as Public Health and Government. After learning this lesson, children, you will be able to list out the requirements for the healthy and hygienic conditions for living, explain the role of the government in the public health. You can compare the public health services with that of private health services, differentiate between the public and private health services. Let me ask you a question. What are the basic amenities required to treat illness? Can you tell me what are the basic amenities we require to treat our illness? Yes, we require good doctors, we require good diagnosis. In spite of all, we require good health. If we have a good health, we don't need any kind of treatment and we will never fall sick and we do not get any kind of illness. If we fall sick, to treat such a kind of illness, we also need laboratories, we also need blood banks. We need health centers because to go for a checkup. For example, if we get fever, we definitely go for checkup. Who will do checkups for us? Yes, doctors will check our illness and give the treatments. If we are severely ill, then definitely we go for several kinds of tests. What are those tests? Where do we get the tests done? We get the tests done in laboratories. For example, if we want to test blood or urine or a stool, we need to go to the diagnostic centers which do all kinds of tests for us. And we also need blood banks, especially in case of emergency conditions or in case of trauma conditions. Trauma means excessive illness and excessive emergency requirement during which we need blood to inject to get the healthy living. Did you understand children? We need good doctors, we need lab technicians in the laboratories and in the hospitals we require nurse for health checkups and extra health connected activities. Let me show you and tell you that India is the largest country which provide health services to its public on a free of cost. Right. In free of cost, India have large type of doctors and well versed doctors to treat the illnesses for the public, and these kind of services provided in India in large scattered villages and towns. Not only in the villages and towns, India is providing the health services at each and every nook and corner of a place. Did you understand, children? Government is providing public health services at nook and corner, at every nook and corner of every village, town, mandal, city, and at district levels also to its public at free cost or at low cost to provide services to its public, as feeling that no one should get interrupted in case of any kind of illness, and no public should suffer in case of any serious illness. This is the responsibility that has been taken by our government to provide public health, taken by our government to provide public services, especially in the form of health care, right. Let me show you, our India is well versed in providing health care services. It also has wide variety of lab technicians and laboratories. India have well versed doctors to treat several kinds of illnesses like tuberculosis, diarrhea, malaria, typhoid, etc. You can also find health workers at every nook and corner of the village or at a city. This is what our India is having. Let us be proud to get born in India. Let us see the statistics of healthcare system in India. India is the fourth largest producer of medicines in the world. India has the largest number of medical colleges. Approximately 15,000 new doctors qualify every year. With these statistics, children, you can easily identify that lot many doctors are completing their doctorates, their degree, coming out to serve the public in the form of giving services to health care or to provide so many social services, especially towards the health care. Let me also show you, in 1991 there were 11,174 hospitals in India. As of 2018, there are 59,332 government hospitals. Some may get the best facilities, while some may not have basic health care system. This is the contrary to which the Constitution of India desires for all the people in the country. Comparing to previous years, in 2018 the number of hospitals has been increased, the number of doctors who completed their medicine also has been increased. But the thing is, there is a contrary, it means there is a difference in providing health care services in India. This is against to our Constitution of India. I hope you understand my point better, right. I would like to say you that health care is a human right. We are having fundamental rights, we are having fundamental duties, but here health care is regarded as a human right. Did you understand, children? Fine. Let us see the case study of Kiran and Sarita. Kiran and Sarita both study in the same school of Karimnagar district. After the end of rainy season, there was a huge boom of viral diseases spreading, especially viral fevers were spreading. In such a case, Kiran and Sarita fall ill, as Sarita's father was financially fit to take her to a private hospital, whereas Kiran's father is not financially so sound, so that he took him to a government hospital. Immediately when Sarita's father checked her into a private hospital, there They had a red carpet and immediately they got outpatient slip, and she had a doctor checkup. Immediately doctor has written some kind of tests for her to be done for the reason of fever. Immediately she went to the diagnosis center. She took her tests. She got the reports and she went immediately with the reports holding to a doctor. There the doctor saw the diagnostic list and immediately he has written the prescription. She came back home within 1 day. In case of Kiran, it was totally different. As I have said you that Kiran's father is financially not in a sound way. They went to a government hospital. There was a huge line standing for outpatient receipt, whereas he also got the number, but at that moment he got the number, it was already time up. Then doctor went for lunch. Till then our Kiran was suffering from fever. After the lunch time, doctor came back and gave him some prescription of diagnosis to be tested, where he went to a diagnostic center in the government hospital itself. There also they saw a huge queue where other patients were having checked for the tests. Likewise, the day has passed. The next day they came back again to the hospital. The same cycle has been run for 3 days. After 3 days he got the prescription for his fever. This is how there is a lot of difference between private health centers and public health care centers. With this, you should get an idea that health care centers are divided into 2 types. The differences between the private health care centers and the public health care centers. Let us see first about private health centers. There you have to pay the fees, and in public health care center no fees to be paid. There will be no waiting in private, there will be a lot of waiting in public health service. In private health services, diagnosed every test in an easy way. In public health services, diagnosis takes time. If you go for diagnosis in the private health services, reports given for the next day. If you go for the diagnosis in the public health care system, reports were given in the next day. And in private health services, you can avail medicines by paying the money, and in the public health services, medicines are given at free of cost. So, you have seen the differences between the private health services and public health services. With this, you should get an idea that public health care services are the services that are provided on a free of cost or at a low cost. Even for the checkup of our body or for any illness, you should pay a lot of money. This is what you can easily identify the differences between the private and the public health care services. I hope you understand. Shall we have an assignment, children? List out the basic requirements for the healthy living and compare private health services with that of public health services. I have already discussed to you that healthcare services are divided into 2 ways. They are private health services and public health services. First, let us deeply discuss about public health services. I have already discussed to you that public, it means which are given to the public by the government at a free of cost or at a low cost. The services provided by the government, right? Yes, let us see. Government itself cannot provide in a single way to all its public, right? In a single hand, government cannot provide all the services. It needs workers, it needs doctors, it needs so many health assistants. So, our government is providing at village level, mandal level, rural level, district level and at area level. This is how public health services are divided into different ways. Let me tell you in detail. First, government adopts ASHA workers. ASHA workers are the health assistants. ASHA workers are the health assistants that provide health services to the conceived women, like pregnant women. They all move from one place to another place in villages, mandals, to see the illnesses of the public. They also provide wide variety of medicines to the public by checking their illnesses. Small illnesses like fever, cold, cough, and even especially pregnant ladies are given regular checkup by the ASHA workers, and moreover vaccination to the children are continuously given by the ASHA workers by installing some stalls at the centers, so that no child should be left over without any vaccination. This is what the importance of the ASHA worker in our public health and government. Anganwadi centers. See, these are the Anganwadi centers that provides nutritious food to the children and for the pregnant women. India is a country where most of the children who are newly born are undernourished. That is why India takes initiatives to provide such centers called as Anganwadi centers to provide nutritious food to 1 to 5 years of children. There children will get egg, dal, rice, some kinds of fruits, play activities in the Anganwadi centers, not only to improve the nutrition levels in the children, but also to improve them physically and mentally. So, is this interesting, right children? Fine. You should also remember the thing that in Anganwadi centers, most of the pregnant women also get the nutritious food. If she gets the nutritious food, then only the baby to get born will be healthy and nutritious in the future generations. They will be healthy in the future generations, right? See the picture where the children are playing in the Anganwadi centers. Here in Anganwadi centers, children's weight is also measured month by month, whether they are improving their weight or not, right? This is the duty of the Anganwadi teachers in the Anganwadi centers. You can also have sub centers at the rural level. More than 5,000 people in the villages can have the adaptability of can have the usage of sub centers, and for every 4 or 5 sub centers you will be having primary health centers, right? For example, all the sub centers are under primary health centers. Primary health center is a center where it is established near the area where the population is more than 30,000, right? In the primary health centers, you can have the primary medication, just like for example, small 2 to 4 stitches you will get. If you get any kind of injury, you can get variety of medication for fever, cold, cough, and regular checkup for pregnancy women, vaccination, etc. will be provided in the primary health care centers at the area of population covering 30,000 people. And community health care centers. community health care centers are the centers established at the community level, where you can find small surgeries will also be done at the community health care centers, in spite of providing wide variety of vaccinations and medications at community health care centers, right. At area level, you will be having area hospitals. At different areas, you can have area hospitals. Whatever the area you belong to, that area people will go to the area hospitals and get diagnosed. All these mean that government would like to provide its services, especially healthcare services, at every nook and corner. This is the vision and motto of the government, that no one should be left behind for its health service. At district level, you will be having district hospitals. This is the picture what I am showing you is the district hospital, that is the district government hospital at Khammam district. Not only the district hospital, area hospital or the primary health care centers presented. Government has also taken initiative to provide a separate building for the mother and her child, which is also called as Mata Sisu Arogya Kendram. I repeat, Mata Sisu Arogya Kendram, where the pregnant women mostly face lot many problems in the private hospitals, where the government has taken initiative to provide all the healthcare services related to the pregnant woman to save her child and provide immunity levels to her and her child. This is what the government is taking a lot of initiatives to provide health services to its public, especially for the women. See the picture. This is the Mata Sisu Arogya Kendram block in the Khammam district. Can you answer me, why do we call it as public service? We call it as a public service because all these services are provided by the government. Then, why do the government provide all these services? Where does it get the finance? From where does it cope up? Yes, the government cope up its expenditure related to the services provided by the government is from the public. The public is one that cooperates and coordinates with the government to provide such kind of services, especially healthcare services, in the form of tax. Whatever the tax that is paid by the public is used by the government in the form of providing lot many varieties of services to its public. It is just nothing but give and take policy, but on a free of cost or at a low cost. You should remember this, right? Private health services, the name itself denotes you, private means it is not on a free of cost. For everything you should get paid. Services provided not by the government are called as private health services. And at the private level, first you will see registered medical practitioners, RMPs, and you also find untrained medical persons. Registered medical practitioners you can see in the villages. For small things like cold, cough or for fever, you do not go for city or area hospital or for at the district hospitals. First, initially you will call RMP. There you get first diagnosed. Then if you do not get reduced about your illness, then you will go to the city or mandal. You can also see lot many untrained medical practitioners in the villages. And children, you should remember one thing, that it is very dangerous for you if you take the prescription of such people who are untrained, right? It is very dangerous. Never ever take such decisions to go to the untrained medical practitioners and take the diagnosis. Did you understand, children? Fine. In the private hospitals, you can get blood tests to be done. You will get urine test to be done. You will have the facilities of X-ray. You will have the facilities of ultrasound. You will have pharmacy facility where after diagnosis, the doctor's prescription, you can take the medicines in the hospital itself. In the private hospitals, if you enter from top to bottom, everything relates with money. Here money matters because it does not provide you any kind of services on free of cost. First you should remember that. And private hospitals provides each and every facility as I have shown you, like it gives you blood tests, X-ray, ultrasound and different types of doctors like laparoscopy doctor you will have gynecologist, you will have dermatologist, every doctor available in the private hospitals, and this is the biggest business, corporate business that has been going on in the society to treat the illness of the public, especially in the private sectors. But the thing is, here you can get treated in a better way and without wasting your time, the illness of public will be treated. Senior doctors and well trained, well versed doctors from the foreign countries. So, most of the people who are financially fit and sound definitely opt for the private health services rather than going to the public health services which provide the service at low and free of cost. It is the time for you to answer the following questions. Differentiate between the public and private health services, and if you fall sick, then which type of health service do you prefer, public or private health service? If you opt public or private health service, then you should give the reason why you opted that service, right? With this, I hope you understand better about health services, doctors, nurses, primary health care centers, area hospitals related to public health services, and you also have better description about private health services, right? Let us meet in the next session, and for the better understanding of the concept, please go through the textbook and visit the official website of SIET and complete the worksheet. Thank you all.